Hello, good afternoon, good morning, and good evening, according to where you are right now. Let me start by talking about the interpretation so everybody can be following the discussion from the very beginning. We have an interpretation in English, Spanish, and French, and we have captioning in English and Spanish. You can select the language of your preference. You can click on the globe icon called interpretation in the bottom and choose the language that you prefer. And we would advise that you also click the mute original language so you can hear the interpreters better. There's also closed captions in the same menu, from the same, in the controls, sorry, it's in the controls in the top of the screen, and you'll see the captioning in the bottom. Once it starts, you can change the size, adjust the size of the captioning on clicking on the arrow next to stop and start the video and choosing the settings and then choosing accessibility and move the slider to make the font as you prefer it. You can also have, for Spanish and captioning, there's a message that I'm gonna put in the chat box, a link that you can follow. Is interpretation working for everybody? If there is any issues, you can write us in the chat box. Let me start by introducing myself. My name is Lumen Darwish. I work as a Gender Human Rights Officer at EIPR, the Egyptian Initiative for Personal Rights. On behalf of SRI, I'm very excited to be moderating the discussion today. I'd like to start by thanking our co-sponsors of the event, the permanent missions of Argentina, Mexico, Namibia, and South Africa, as well as the Pleasure Project, CIES, Salud Sexual, Salud Reproductiva. My Spanish is terrible, excuse me. The Association for Women's Rights in Development, AWID, the Asian Pacific Resource and Research Center for Women, ARROW, the Center for Reproductive Rights, the International Planned Parenthood Federation, IPF, the Swedish Association for Sexuality Education, RFSU, Rutgers, and UNFPA. Thank you so much for being here today, and I'm so excited for our panelists, our great lineup of panelists. Let me start by giving you a general idea of our discussion today. I'll try to keep it as brief as possible so I can give more space for our panelists. We're going to discuss today the impact of COVID on comprehensive sexual education. To start with, of course, the impact of COVID that's the clearest is the closure of schooling, which had a huge impact on comprehensive sexual education. And while disturbed person education for months, even for up to 2 years in some cases in some countries. And of course, in these conditions, sadly, what was impacted the most, something like CSE was seen as non-essential or a side thing that can take a step back. And putting this in the context while schools are being closed and like reliance on the internet is higher and higher for education, that meant that the inequality in internet access had a way bigger impact than before. And we can put that in the context about like 40% of the world's population lacks consistent or any access to the internet. We have 2.2 billion people under the age of 25 who lack internet access at home. And when we put into context the gender discrimination when it comes to internet access, the situation becomes even worse. So in some countries, throughout the world, the gender divide internet access is about 17%, and in the least economically developed countries, it's up to 43%. As well, the closure of schools also meant the closure of libraries, public access to the internet, which meant that families or like households and young people had to make decisions related to in a very, very dire situations where they had to basically choose between different necessities. while where they were struggling, many people were struggling to find end meet, to ensure that they have proper access to housing, health in the pandemic. And ensuring that they can actually, not a lot of people were able to provide internet access, reliable internet access in the meanwhile, which meant that young people were isolated at home, sometimes in very unsafe situations, with no access to adults outside of the home setting, and without access to CSE that they can access privately and independently outside of the school system. But this is only when we look at the situation under COVID, which had a huge impact. And actually, with time only, we can see the real impact of the disturbance of CSE and SRHR in general on young people, and how much during the pandemic, throughout the pandemic that's ongoing, this had the impact we'll see in the future, not right now. But this also is in a bigger context, that CSE in itself faces obstacles even before COVID. So CSE is recognized as not only a standalone right in itself, but also a necessary element in the fulfillment of other rights, a wide set of rights related to sexuality, gender, reproduction, livelihood, and education, non-discrimination, and freedom from violence. While many states and regions in the world have actually ensured and recognized the transformative impact of CSE, and have taken political, financial, and policy steps to ensure that children, young people, and adolescents can have good access to CSE. And while CSE is recognized as a range of negotiated text and sub-regional and regional and global levels, including the Eastern and Southern African ESA Ministerial Commitment, the Montevideo Consensus, and WHO European Region Action Plan for Sexual and Reproductive Health. Also, CSE is affirmed in multiple resolutions as essential in addressing various SRHR concerns from preventable maternal mortality and morbidity to ending discrimination against women and girls. The special rapporteurs on the right to education and the right of everyone to the enjoyment of the highest attainable standard of mental and physical health, the Working Group on Discrimination Against Women in Law and Practice, the Committee on the Rights of the Child, Economic, Social, and Cultural Rights, and the Elimination of Discrimination Against Women have all identified the right to a CSE as both a standalone right and necessary element in other rights. And while there is a growing, even though uneven and struggling commitment and realization of the importance of CSE, there is also a continuous resistance to that right. There is this resistance and pushback that takes several forms, including stipulation about parental consent, which can seriously hamper the rollout of CSE. Of course, abstinence-only models, which might have like a huge impact on this. Has a huge impact on access of young people to proper CSE, and also issues related to funding, commitment, and training for staff who are actually helping the young people with introduction to CSE in schools and outside of schools. CSE, when taken seriously, has a very positive impact on vigilant society and young people in general. And other than the funding, the commitment, and the logistical barriers to CSE, there is structured barriers, which is like clearly can be seen in the under-resourcing of CSE programming, dealing them that the staff are not receiving the enough training and resources that they need themselves to be able to present young people with better resources on CSE and better education and comprehensive one before anything else. I'll try to keep it at this to be able to, to introduce you to our first speaker. Are we working? Yes. we're happy today to have with us in person, online at least, and live, I mean, Dr. Tlalang Mafokeng is the United Nations Human Rights Council Special Rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. She is a best-selling author of the book Dr. T, A Guide to Sexual Health and Pleasure. Dr. Tlalang Mafokeng is a distinguished lecturer at the O'Neill Institute for National and Global Health Law at Georgetown University, and extraordinary senior lecturer at the African Center for HIV/AIDS Management at Stellenbosch University. Dr. T, it's great to have you with us today live.
Hello, and thank you
so
much. I'm so happy that I could actually join all of you live instead of sending a video. And so thank you so much for involving me in this important discussion. And I'm really thrilled to talk about comprehensive sexuality education, which is a topic that is very close to my heart, only because I am a medical doctor still in clinical practice. And many of my patients are people who need sexual and reproductive health services and information. And in fact, the way that I got into this career of being a sexual and reproductive health doctor was actually in my own community service year as a junior doctor in South Africa, in the West Rand of Johannesburg, where I started noticing a trend of young people who would come to the clinic, of course, explaining a particular type of physical symptom. But it became clear to me that, in fact, young people just needed access to healthcare workers to be able to ask them information about their health, but also specifically their sexual and reproductive health. And they didn't have a way of accessing that information without coming in with a particular physical ailment first. And that got me thinking very intentionally and deliberately about the different ways in which information is available to young people, especially when we know that comprehensive sexuality education, even in countries where there are policies and there's particular protocols on how to do this, it's still not being implemented, right? And so even in structured learning in schools, we couldn't take for granted that young people are having this information. And also thinking about the youth and young people and older people who are outside of school who do not have access to the structured learning. Where are they getting this information? And that kind of sparked my interest in being a health communicator, an effective healthy communicator, and also focusing specifically on sexual and reproductive health, because I realized that for many people, especially young women in the communities that I was a doctor in, when things went wrong around their sexual and reproductive health, some of those consequences were lifelong for them. And it didn't have to be that way, but it was because there was a lack of information, there was a lack of access or linking people to care timelessly, but also when they were accessing the care, there was also a lack of knowledge and understanding of healthcare providers on why it's important to see our work as healthcare workers as a promotion and a defense of human rights, because we deal with such key principles and literally people's lives. And so I come today to this webinar with that sort of experience and a lived experience that I have seen as a young person growing up and knowing what my needs were, but also seeing as a medical doctor how for many people, the public health system is still very much focused on treating illness and not enough on health and wellness, and specifically around sexual and reproductive health. And we know that sexual and reproductive health are integral elements of the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. And the nature of challenges associated with sexual and reproductive health rights, especially in adolescence, have been examined by the mandate even before my tenure. And healthy sexual development requires not only physical maturation, but an understanding of healthy sexual behaviors and interactions and a positive sense of sexual being. And I think this is a very important element for me. It's this idea that sexual health is not merely about avoidance of disease, but it's actually about understanding, it's about behaviors, it's about relationships and communication, but also ultimately an individual's own right to have a positive sense of sexual well-being and having those respected and protected. And of course, sexual initiation is a natural and a healthy aspect of life, and especially adolescents who are very inquisitive. They have a right to be provided with the tools and information to navigate this time of their life in a manner that's affirming for them. And I often think about older people, right, who as adolescents never had affirming information, never had affirmation about their sexual rights, the rights to be who they truly are and express that. And what are we doing for those people who are no longer adolescents but missed out because of a lack of implementation of CSE in schools and in other structured learning methods? And we know that around the world, whether you are an adolescent, girls and boys, women especially as well, still face significant discrimination and barriers in accessing information. And we know with the right to health, the right to information, including on sexual and reproductive health, is a human right. It's part of the right to health, and it's something that we must protect. The right also to information, I believe, must also be supported by access to services and goods and commodities that are important for us to fully realize our sexual and reproductive health rights. And yet we know that many of the discriminations, the stigma, lead directly to rights abuses and violations, especially of the right to health. And I think comprehensive sexuality education is about assisting young people with the tools and skills to transition healthily into adulthood. I think it's important to focus on the particular needs of young people. And unfortunately, many sexual health interventions, of course, only focus on risk and abstinence, which I think is inadequate. That approach fails to acknowledge an individual's sexual rights, as well as their particular desires as relationships and pleasures, but also their agency. And I think it's our collective role and goal should be to positively influence attitudes, behaviors, as well as technical, legal, and policy interventions towards a better integration between sexual health, sexual rights, and sexual pleasure. And it's important, and I think, and I've seen this, as someone who's observing trends around the world, that there has been many third-party, many non-governmental organizations who are pushing back directly against this access to information around CSE in schools and in many other areas as well. And the Committee on the Rights of the Child has clarified that there should be no barriers such as requirements for third-party consent or authorization. And this was important for me as I was reading on the African Charter on the Rights and Welfare of the Child, for example, because we see particular regions on the sub-Saharan Africa where NGOs are actually going into schools, right? And the education system has become the place where people who are anti-rights, anti-CSE, anti-gender equality, anti-gender in general, have found a fertile ground. And so I think it's important to also remind all of us that, in fact, states should undertake efforts to overcome not just barriers, but to also make sure that there are no third party that will impede access to information, especially in schools, but throughout. And we know that stigma is not only about just adolescents, but we have people with disabilities, adolescents with disabilities. We have LGBTIQA+ adolescents as well. And the content of the comprehensive sexuality education needs to be affirming for those adolescents as well. And just in closing, because I don't have a lot of time left, I think it's important to also speak about the fact that we must not try to separate young people's development and their inquisitiveness about the world from their own sexuality and development. Their own sexual health and development is not removed from their overall development. And young people can be moral and religious and smart, and they are absolutely also sexual beings. And so as teachers, parents, religious leaders, traditional leaders, civil society, politicians, member states, we must uphold human rights. There is no opting in or out of human rights and these very important principles of self-determination, consent, safety, privacy, access to information. And I think for all of us, CSE should be seen as a life skill at all life stages. We all need that life skill. Like when you drive a car, we all understand the need to know the rules of the road, respectful driving, defensive driving perhaps. We need to know about checking the car safety and wearing a seatbelt, right? So we shouldn't see CSE as anything other than a life skill that everyone at all life stages need, but particularly adolescents as they transition from childhood into adulthood. And I think it's all of us to make sure that we assist children understanding the important aspects of consent, respect for boundaries, for example, seeking consent and giving consent, which are very, very important. And so in closing, I just want to say and leave you with this quote that I said when I was launching my book a few years ago, that in fact, the unshackling of women's bodies, sexual desires, and pleasure is the revolution for many women across the world. And we need to be bold in reclaiming our sexual pleasure, our sexual expression, our sexual rights, and especially our sexual health. And this is true for all diverse people who have historically had their bodies served as a site of political warfare. And just the knowledge of how your body works, the knowledge of that this body belongs to you, the knowledge and the affirmation of your human rights as it relates to your sexual and reproductive health, it's something that we must all protect and absolutely claim for everyone. And I think, and just a reminder in closing, that states must respect and protect principles of non-discrimination, equality, and privacy, as well as integrity, autonomy, and dignity, and the well-being of all individuals, in order for us to actually realize all our rights to the highest attainable standard of physical and mental health. Thank you very much.
Thank you so much, Dr. T. That was a great ending. I forgot to say something. If you have any questions to any of the panelists, you can add them to the Q&A window. I can identify which panelists would you like to actually target your question to, you can say that, unless otherwise it will be up to the panelists in the end. By the end, after all presentations, we'll have 15 minutes or so in the end to answer all the questions that you put in the window. So next with us, we'll have Mr. Julius Natangwe Nigifakwa, who's a teacher by profession with vast experience in teaching natural science and health education, life skills as subjects. Apart from that, he serves as educational planner, inspector of education, and now deputy director of programs and quality assurance in the Ministry of Education, Arts and Culture, responsible for the coordination of the implementation of educational programs and policies in schools, school health, HIV, SGBV, HRSR in schools, as well enhances the capacity building of educators and life skills teachers on CSE and SRHR issues, to mention quite a few. Mr. Julius, if you can join us. You can turn on the camera, that would be great.
Hello, my camera, you have to help me to.
Sure.
Yeah, it says that the co-host has to help. I'm starting my video. Okay, now.
Okay.
All right.
Great.
Can you see me?
Yes.
All right. Good morning, good afternoon, good day to everyone. This is Julius Nyifikwa, as it was rightly introduced. So I would like to join the discussions and the comment or sentiments made by Dr. Tlaleng Mafokeng from South Africa. I'm actually calling from Namibia, and we are neighboring countries here. And what she actually presented is exactly the context of Namibia. So to start, the Ministry of Education, Arts and Culture in Namibia has been all along implementing or rolling out health education in the country, as from pre-grades up to the matric, that's now the last grade in the basic education level. The subject called life skills has been used to provide HIV education when the country became independent. So HIV was really an issue, especially around 1998, when the scourge of HIV was at 22.5% nationally. So therefore, it was then decided that the Ministry of Education should contribute to the minimization of HIV pandemic in the country. Hence, these programs, started. That was now around 1998. I'm now talking about the activities to target, specifically to target HIV in the country. So now, with the signing or confirmation of ISA commitment in 2013 in South Africa, Cape Town, it was, I think it was on the 7th of December, 2013. So Namibia, as other member countries, agreed. So we started revising our curriculum to see the gaps and see to it that the curriculum is so sufficient to provide the relevant life skills-based HIV and sexual reproductive health education. So we have revised the curriculum as from grade 4 to grade 12, age appropriately, to make sure that young people are provided with the necessary knowledge, attitudes for them to be able to make right choices when it comes to sexual activities or sexual issues in their lives. So I would like to indicate that when we started rolling out, so it was evident that teachers were not really confident in discussing sexual issues with the children because they have sexual issues with themselves. They are not confident with their own sexual issues. So we then started rolling out together with our stakeholders, especially development partners, UN agencies, and civil societies. We came up with a coordinating structure at the national level to make sure that this curriculum, which has been revised, is taught by people who are confident, who are able to explain explicitly as to what are the issues, what are the sexual issues that learners need to know. The body autonomies, the prevention of STIs, and the impact of those STIs if they are not, if they are not prevented. So what we did then is we rolled out the face-to-face training of teachers, and then we rolled out online training. So this is what we have been doing all along since the signing or the confirmation of ISA commitment in South Africa. And this activity started way back before COVID even came in. So we started now mobilizing resources at the national and the regional level. We engaged the traditional leaders, we engaged politicians, we engaged the general public to explain the concept of comprehensive sexuality education until 2020, when we have then received a complaint, or I should say a criticism or resistance from faith-based organizations. So we then experienced such type of resistance, and then we decided to address the resistance. So we explained to the cabinet of the Republic of Namibia, we explained to local authorities, we explained to parents the aims and objective of the project or of the program. We are now talking about ESA commitment, which which is which is giving us the power to implement the sexual reproductive health program in education system. Apart from that, what we have also done is to come up with documents, documents that are explaining the rights of the children, rights to bear children at the right time, the rights to education, rights to access, to sexual reproductive health services, information, and the products. We are talking about family planning. All these programs have been initiated at the national level and they cascaded down in the regions and into schools. Together with the Ministry of Health and Social Services, together with the Ministry of Gender, together with the police, Namibian police, we are together because laws have to be explained. The Constitution of the Republic of Namibia is clear on the rights of children and on the rights of a person. All these programs were actually based on the legal instruments that we have in the country. So I want to go back to the resistance part. So when we started now rolling out the CSE, we started using or training the teachers using the international guidance on comprehensive sexuality education, which was supported by UNESCO. So now there are some parts in that guide which the public is not happy in Namibia, especially faith-based organizations and traditionalists, people who have got very strong cultural values. They feel that young people do not need to be told on how to prevent, pregnancies using different devices. We are talking about condoms. We are talking about pills, morning after pills, all those type of things. They are really resisting that. But then we continued mobilizing, we continued campaigning, we continued convincing them. Only then to realize that they went as far as the prime minister, the government, to convince government that the ESA commitment should not be given a second chance in Namibia after the evaluation of the first round. But then we decided as a ministry that we need to prepare. I myself prepared the presentation together with my Minister of Education. We went to cabinet. We requested audience actually with the president and the cabinet as a whole to demystify the public perception that CSE is promoting homosexuality. That's what they were saying. It's promoting sex, actually sexual intercourse. It's promoting anarchy. That's what they were actually saying. Therefore, they are vowing to that the ESA commitment should not be introduced again. It must be cancelled. So we went there as a Minister of Education to cabinet. We presented. We gave statistical data. We gave the objectives of ESA commitment. In fact, the curriculum, I presented the curriculum because remember I said we have reviewed our life skills curriculum. We have reviewed our natural science and health education curriculum. We have reviewed our life science as a subject, and then biology for senior secondary education. We have reviewed all those curriculum programs to address topical issues on CSE and the sexual reproductive health. So I presented that now to cabinet. And then I was told to go out as a technical person. I went out, and then I actually went back to my office. I left the minister there to discuss the whole issue with the other cabinet members, only to receive a letter, a very positive letter after a week that yes, they are satisfied now, they were misled. So Namibia should participate again, should continue with the implementation of ESA commitment. So in other words, we should go ahead with our program as such. But as I'm reporting to you, colleagues, still the faith-based organizations are not resting. They are still resisting. Last week, they were planning to have a audience with the Minister of Education to introduce biblical study, apparently in the education system, to introduce the Bible study. I went through the Bible study myself, and the way it was taught to Christianize a person. But after independence, we have a subject called religious and moral education, replacing biblical study. So, but they are now trying to bring biblical study back as it has been before. But it's not going to be possible because Namibia is a secular state. We will not entertain that. And that's what actually they are trying to do in order to bring apparently an alternative to CSE, to bring alternative to CSE, which is completely out of equation. So that is what we have done, and we are just going ahead. We have programs that are lined up to train and introduce newly appointed teachers to this concept of CSE, human rights. I have a pocket guide here, as you can see. This one is a guide for sexual and reproductive health rights, laws and responsibility for the young people. In other words, young people should have responsibilities. They cannot be just given rights, but rights with responsibilities, so that they understand very well what is it that they are expected to know, what is it that they are expected to have in life, and that they should safeguard their rights. And if somebody is abusing them, especially sexual abuse, they must know that this person is abusing me. And if the environment is not conducive, environment is more conducive for sexual harassment to be done or sexual abuse to take place, they must know. So we have programs that are lined up, and we are continuing. And as long as the Ministry of Education is in existence, these programs have to go ahead. Of course, after 5 years, we are going to review our curriculum again, and we will keep updating and coming up with the relevant program. So the government is helping us financing HIV education in the country together with our stakeholders. We are happy. We are attending workshops. We are equipping each other, sharing resources. I think within a few years' time, we will not have any resistance from the public, because we want to continuously campaign. With the COVID, we have actually rolled out COVID vaccine for the children 12 to 17 last Friday. So next week, the groups will go to different places of the country in schools to vaccinate, give education, engage the public, the parents who have to give the consent. They need to be given information, demystify the effective the doubt on the effectiveness of the vaccines, and all those type of things. So of course, yes, we have a problem that the country is big. We don't have enough health facilities. Some facilities do not have electricity. So we are trying our level best to make sure that we go into rural areas and the marginalized communities are taken care of. People who are living with disabilities are also focused so that they are reached with these services. We don't want to leave anybody behind. So that is our motto. Everybody must be taken care of. So in short, this is what is happening in Namibia, and I will be willing to respond to any question on the chat box. Thank you so much. Thank you so much,
Julius, and that was very helpful. And there's something there to learn about how we can hold strong in front of, and states can hold strong in front of disinformation when it comes to CSE and resistance from different groups to CSE programmings, and how the state commitment to that can make a huge difference. Next with us is Maria Bakarodis. She's a sexologist with over 28 years of experience in SRHR and sexuality education in varied contexts and populations across 5 continents. For the past 7 years, she is the Comprehensive Sexuality Education Specialist and focal point on sexual and reproductive health and rights among young persons with disabilities for the Safeguard Young People Program of the UNFPA's East and Southern Africa Regional Office. Maria's profession vision is to contribute towards enabling all people to experience their sexuality in healthy, equitable, pleasurable, and responsible ways. Maria will also touch up on how can the issues related to CSE and challenges, and how can they be faced, and which will address some of the questions that already appeared in the questions and answers.
Thank you very much. I have a PowerPoint, if we can just load that up. It's so great to be here among my fellow panelists and all the participants online. I'm just waiting for the PowerPoint to come up. But while we're waiting for that, we just want to applaud the government of Namibia and other governments in the region and across the globe that are staying firm on their commitment to young people's sexual reproductive health and rights through CSE and linking them to services. Okay, so I am going to speak about incorporating emerging issues that, like our moderator has touched upon, are issues that predated COVID, but now are exacerbated post-COVID. The relevance of out-of-school CSE, leaving no one behind, incorporating issues like climate change and linking to services and things like that. Next slide, please. Okay, I'm not going to go into much detail here, but this is just to give us a kind of a snapshot at some of the global and regional commitments on CSE. And what we see here in the later stages is, 2030 is not that far away. And we have updated the ESA commitment for the term 2021 to 2030, as Julius has alluded to. Next slide. We're also trying to do an Africa Union strategy to unify Africa in its position on CSE and education for health and well-being. But, aside from that, we know that CSE has value in imparting knowledge and life skills and health promoting attitudes, but it also has that demand generation potential for the supply of SRHR services and commodities. Okay, and so most countries have committed to universal health coverage. And UNFPA has worked with other partners in looking at what that looks like for young people in terms of adolescent sexual and reproductive health services, that basic package of services. And there you see, if you look at all the components and how they impact on young people in particular, we see contraception, an unmet need for especially unmarried young people, HIV and STIs, safe abortion, post-abortion care, GBV, maternal and newborn health, and all of these different components. But now we have CSE squarely amongst this bundle of services. So our positioning of CSE within a discourse of health and education is stronger than ever. We know we cannot get to our goals of health and education without CSE bridging the two sectors. Next slide, please. Okay, so when we talked about some of the challenges and how it's already difficult to provide that gold standard of CSE even prior to COVID. And now it's been more challenging because we know that especially ministries of education have been struggling with how they're going to catch up on the curriculum and the time lost during lockdowns, and that prioritizing, what they consider the more essential topics like literacy and mathematics. But so keeping CSE will require that advocacy ongoing in the catch up and recovery strategies, in distance learning offerings, but we know it's so important because we know that sex didn't stop, puberty doesn't pause for pandemics, and all of these issues are still happening, in fact, intensifying, as we've seen in some parts of the region, or where we see rises of gender-based violence, unintended pregnancies, child marriage, other harmful practices. And so by default, what was being provided during the strict lockdowns and school closures was out of school CSE. And while we were doing out of school CSE prior, it really has taken on additional relevance. Next slide. Okay, and so, you know, when we talk about all the opposition, I always, if we were together in a room, we'd do this nice interactive pie chart where I'd ask you to identify all the sources of sexual learning that young people have, you know, and we would fill in this pie chart and we'd see, you know, friends, partners, other family, the internet. There are so many sources of sexual learning for young people, and that they vary in terms of their quality. Some are factual, some are fake news, some are moralistic, some are just straight up conflicting. And so, you know, if we aren't part of this pie and a big piece of the pie, young people will certainly find out about sexuality elsewhere, and it may not be the most reliable or balanced type of information. So, you know, this is a tool we use with parents, with religious leaders, with teachers in training, to underscore that really, you know, the ship has sailed. We're not even trying to debate whether we need to do CSE. We're beyond that. Next slide, please. Okay, and so, you know, while we're trying to impart a form of CSE that's gender transformative and based in human rights and leaving no one behind, we're also looking at ways in reaching the furthest behind first, okay? So while we're trying to improve the quality of CSE as an ongoing task, we're continuing to look at the state of the art of CSE in terms of the content and how it's delivered, and how we have to be flexible in incorporating issues. We're looking at now, obviously, the impact of COVID-19, mental health issues, well-being. That's why, you know, some partners are choosing to use terminology that speaks about education for health and well-being, more inclusive. We're also looking at the impact between climate change and SRHR, which is an emerging issue that UNFPA is also leading on. We're looking at expanding menstrual health into CSE. We also know that we have to approach CSE from the point of view that some of those learners in or out of schools have been, have been exposed to gender-based violence and sexual violence. And so trauma-informed approaches to CSE is very important. And the balancing of how sexuality is presented in terms of incorporating pleasure. And there, you know, we see that out-of-school CSE gives a bit more flexibility in that regard, where you can push some of the sensitive topics. Okay, so we know that we have to continually work on teacher training and other out-of-school facilitator training, looking at those digital solutions and making sure that they are of quality and not just, you know, the real comprehensive part of it, okay? And then when it gets to leaving no one behind, we're going to talk about that in a minute, about UNFPA's work for young people with disabilities and living with HIV. But one thing, next slide, to reiterate, is that out-of-school CSE complements and extends in-school CSE. So UNFPA has an international technical and programmatic guidance on out-of-school CSE that complements the international technical guidance on CSE that speaks to the learning objectives and the age appropriateness and all that kind of stuff. Next slide. Okay, so basically when we talk about out of school CSE, we're talking about anything that's happening outside of the school curriculum, okay? So it could even be school-going young people on holidays and weekends. And in our part of the world here in Southern Africa, we know about half of Africa's young people are out of school. So Dr. T mentioned how important it is to make sure that they get that CSE. And it's usually the most vulnerable young people that are out of school. Okay, next slide. Okay, and so the guidance really gives programmatic information around how to engage, whether it's single-sex groups, whether it's young people with disabilities or in humanitarian settings, Indigenous young people, LGBTI, intersex, young people living with HIV, et cetera, use drugs. Next slide. So there's a lot of good information because we know that in-school CSE may not be able to get to that level of depth and inclusion for their needs. And this is just a slide showing the existing resources we've already had for out-of-school CSE in the region, including a MOBA site, including targeted resources, Amaze videos, a music edutainment album. Next slide, I'm running out of time. And then we have a whole package called Breaking the Silence Approach to CSE for Young People with Disabilities. We know the vulnerabilities for young people with disabilities is particularly acute. Next slide, but we know young people want to have pleasurable sex and have families just like anybody else. And so we have this package that can be used in and out of schools that applies the principle of universal design and reasonable accommodation. And what that means is that all the activities are adaptable per disability type. Next slide. Okay, and they're just different examples of where you can use visual cues, stories, touch, taste, use all the senses in how you teach CSE in a quite direct way, I must say. It's even more direct than quote unquote traditional CSE. Next slide, please. Okay, and that's what they look like. We've piloted them. We have a lot of evidence around them, and we hope to roll this out. Next slide, please. Okay, and then climate change. So, this is not a natural connection between climate change and SRHR, but we're using CSE platforms to bring in climate change information. And because people don't know what those links are, the basics are that they harm maternal and neonatal health, they exacerbate gender inequalities and lead to increased GBV, and they disrupt the availability of services and access to commodities. Next slide, please. Okay, here's my last slide. So if you had to give me 30 seconds to say what CSE's value added is, we know it reaches large number of young people in and out of schools over time. So that life course discourse that Dr. T mentioned. And that's why it's important to scale up and saturate and institutionalize what we're doing in a sustainable way inside and outside the formal education sector. CSE is a true form of prevention in that it aims to impart knowledge, skills, attitudes, and behaviors at those strategic moments in a young person's life before they're actually needed. So here what we're saying is CSE, it works towards the development and maintenance of healthy SRHR behaviors versus the need for behavior change. Okay, so we're trying to prevent, we're trying to develop and maintain good behaviors versus the work it needs to promote behavior change. Although, of course, behavior change and mitigation of negative SRHR outcomes is part of CSE. And it, as I said, it creates demand and utilization of services and commodities. And we've also heard time and time again, it is the right of young people to access this information and this balanced approach to CSE, where it's not all doom and gloom, but that, there are obviously positive aspects of CSE and sex that motivate people to have sexual relationships with other people. So, we just need to give CSE a long-term chance, all those fidelity issues to really produce good impact evidence over time. And my last slide is the thank you slide. I thank you very much and look forward to working with all of you in the future. Thanks. Over.
Thank you so much, Maria. And as Maria just said, puberty and sex do not wait for the end of the pandemic. And that's exactly why our next speaker will be speaking about out-of-school CSE during the pandemic and the effect of COVID. Our next speaker is Paola Paniranda Bayorel. She is a national education manager for CIES, Salud Sexual, Salud Reproductiva in Bolivia, with over 15 years of experience promoting the sexual and reproductive rights of women, adolescents, and youth. She has degrees in psychology, strategic NGO management, and administration, as well as in comprehensive sexuality education, special education, and curricular adjustments, and in continuous quality improvement of health services in gender health. Her expertise in facilitating comprehensive and differentiated care has been recognized by UNFPA and Repro Latina Brazil. To you, Paola.
No. Hola, ¿ahora sí me escuchan? Hola, buen día a todos y todas. Muchas gracias por la invitación de poder compartir nuestra experiencia en educación integral en sexualidad durante la pandemia. Yo pertenezco a CIES, que es una ONG que está a nivel nacional en Bolivia. Y bueno, lo que quiero compartir con ustedes pues es cómo era CIES antes de la pandemia, cuál es el contexto en el que nos desenvolvimos durante esa etapa, los desafíos y estrategias que implementamos y los aprendizajes. A nivel nacional, nosotros como institución realizamos procesos de formación en educación integral en sexualidad y lo hacíamos meramente con metodologías presenciales, ¿no? Con procesos de más de 35 horas que permitían un trabajo en conocimiento, en actitudes, en desarrollo de competencias. Y esto lo trabajábamos con maestros y maestras a nivel presencial, con jóvenes también y adolescentes de unidades educativas especialmente. Así hemos conformado una red a nivel nacional de profesores, una red nacional de jóvenes que se moviliza y se movilizaba antes de la pandemia solo a nivel presencial en diferentes espacios aquí en el país. Además, también realizábamos procesos de capacitación y sensibilización al entorno, también presenciales con más o menos 9 horas de capacitación y de procesos, ¿no? Procesos largos de capacitación meramente presenciales. Entonces se viene la pandemia. ¿Y qué nos trae la pandemia? Nos trae una etapa en la que tenemos que enfrentarnos a las limitaciones de transitabilidad, especialmente de niños, adolescentes y adultos. Tenemos las cuarentenas rígidas que luego se fueron flexibilizando y se cierran intempestivamente las unidades educativas. Y es ahí donde lanzan desde el Ministerio de Educación pues las clases virtuales. Las clases virtuales sin tener el conocimiento de herramientas, sin tener conocimientos acerca del el manejo de la tecnología, el analfabetismo virtual, ¿no? Y esto obviamente genera, como ahí muestro en la imagen, mucho miedo, mucho estrés, mucha ansiedad, resistencia de parte de maestras y maestros, y también de los estudiantes, ¿no? Quienes en algún momento, pues, se evidencia que no tienen acceso a tecnología e internet. Sé que esto es una realidad de muchos países. El gobierno intenta entregar celulares a los colegios, pero alcanza más o menos a 2 celulares por unidad educativa, lo que para nada abastece, y empieza a haber obviamente limitaciones de tiempo de profesores y estudiantes para contactarnos con ellos, para poder realizar procesos de formación. Y bueno, todo esto ocasiona deserción escolar, sube de 4 al 10%, y es ahí donde el gobierno determina la clausura del año escolar, ¿no? Entonces, ahí, ¿qué hacemos como institución? Una institución experta en educación integral en sexualidad, pero con metodologías meramente presenciales. Y ahí empiezan los desafíos, que quiero compartirlos de manera detallada con ustedes, y las estrategias que hemos implementado a nivel nacional. Nos hemos topado con resistencia de los profesores para implementar los procesos virtuales, porque obviamente no tenían conocimiento acerca del manejo de estas herramientas virtuales. Ya habíamos mencionado el analfabetismo virtual, y no solamente de parte de los profesores y profesoras con las que trabajábamos, sino también de jóvenes y de nuestro propio equipo a nivel institucional. Entonces decidimos realizar procesos de capacitación. Teníamos que desarrollar inmediatamente competencias para trabajar con herramientas virtuales. No había más, sino todo el equipo educativo de CIES desaparecía, porque las unidades educativas donde era nuestro centro de trabajo, pues estaba cerrado. Es así que nosotros organizamos 3 ciclos de capacitación. Un ciclo de capacitación relacionado con la producción de audios, otro ciclo relacionado con las herramientas virtuales, como desde el manejo de plataformas, aplicaciones de Google, transmisión en vivo, elaboración de pizarras colaborativas. En tema de locución vemos registros y grabación, elaboración de podcast, y también tenemos un tercer ciclo de presentaciones interactivas para elaborar GIF, presentaciones animadas en Canva, Press y videos animados. Todo esto abre el panorama del conocimiento que teníamos acerca de la tecnología, a la que en ese momento le teníamos miedo, a la que en ese momento teníamos resistencia. Creo que estas capacitaciones han permitido que nos demos cuenta de todas las herramientas y el bagaje de herramientas que podríamos utilizar en los procesos de educación integral en sexualidad, que ahora nos exigían sean virtuales. Es así que a partir de estas capacitaciones nosotros planteamos 3 estrategias nacionales: los foros, los youtubers y radio, ¿no? Para implementarlas de manera nacional, de manera global. Es cierto que en el momento que empieza la pandemia y empezamos las capacitaciones, todos empiezan a hacer de todo, ¿no? Para aplicar las herramientas, lo que un poco desorientó el trabajo que estábamos realizando, y realmente en el momento nosotros no ofrecíamos procesos de educación integral en sexualidad, sino más bien actividades informativas, lo que cambió después de todo este proceso de aprendizaje. Yo quiero mostrarles, compartir con ustedes algunas infografías que elaboraron los del equipo, los jóvenes, los profesores, el equipo educativo, donde pues promocionan los foros que realizamos a nivel nacional. También quiero reproducir algunos videos de jóvenes que elaboraron sus videos y los colgaron en diferentes redes sociales, de profesoras, y algunos audios de la estrategia de radio, porque también aprendimos a utilizar la radio como un medio de información en educación integral en sexualidad. Les voy a compartir uno de ellos. Aquí está. Solamente voy a reproducir un poco de cada uno de los videos, porque no nos va a alcanzar el tiempo, para que ustedes tengan idea de cómo elaboraron los materiales. Entonces aquí les voy a presentar de uno de los líderes juveniles.
Hola, amor. Hola, amorcito. Amor, ¿me prestas tu celular un ratito? Quiero buscar algo en internet. No, mi amorcito, ahorita estoy ocupada. Amor, por favor, un ratito. No. Amor, ¿por qué tiene contraseña tu celular? ¿Me das la contraseña? No, mi amor, no te voy a dar. Es mi privacidad. Ah, ya pues, mi amor, dame tu contraseña. No, lo siento. ¡Dame la contraseña! No, y no es necesario que te pongas así. Dame la contraseña, mi amor.
Ahí está uno de los videos que realizaron los jóvenes respecto al amor tóxico. Aquí uno de los videos que realizó una de las maestras.
Esta es la historia de Carlos y Carla. Carla era una joven muy alegre y cariñosa. Estaba perdidamente enamorada de Carlos, quien era mayor que ella y algunas veces tenía mal genio. Cierto día, Carla corría muy apresurada al encuentro con Carlos, pero cuando llegó al parque, Carlos aún no había llegado. Miró por todos los lados y no lo encontró. Entonces, decidió esperarlo. Después de media hora, Carlos llegó y con el mal genio que lo caracterizaba, la llevó rápidamente a la cafetería. En la cafetería, ya más tranquilos, empezaron a conversar. «Carlitos, mi amor, debemos empezar a ahorrar para nuestra boda», le dijo Carla. Y Carlos, muy molesto, le respondió: «Tú sabes que yo no tengo un trabajo fijo, así que no me pidas eso. Es más, no tengo ni para pagar la cuenta de hoy».
Este es un video que utilizaron los profesores para trabajar el tema de violencia en la pareja y como lo ven, han utilizado recursos que ellos mismos tenían en casa, ¿no? En cuanto a radio, quisiera que escuchen solamente la introducción de uno de los programas.
La evolución ha llegado a tus oídos.
Con el espectacular, poco convencional, auténtico y único.
Programa radial Mundo Joven.
Con entrevistas, reportajes, radiodramas y curiosidades.
Todo en torno a nuestra sexualidad, solo por Mundo Joven.
Quédate y disfruta esta hora de entretenimiento.
Bueno, esos son algunos de los materiales que les puedo mostrar, compartir, que elaboraron los maestros y los jóvenes. Y como ustedes pueden ver, no fue necesario contratar consultores para poder elaborar nuestras herramientas virtuales. Son más bien muy creativos los de la red de jóvenes para lograr esta la elaboración de estos materiales, ¿no?
Esta es la historia de Carlos y Carla.
Bueno, también en cuanto a la red de profesores, pues y la red de jóvenes, mejor dicho, red de profesores y jóvenes, vemos que se desarticula porque no hay el contacto necesario como para poder organizarlos, y es ahí donde trabajamos para poder lograr que todos los profesores antiguos, pues los rescatamos para que puedan continuar con los procesos de educación integral en sexualidad con sus estudiantes y fortalecerlos en estas herramientas tecnológicas. Hemos proporcionado megas a profesores y jóvenes para que puedan acceder a esta tecnología. Hemos priorizado temas en las plataformas Classroom, ya no desarrollábamos toda la currícula, y bueno, hemos utilizado aplicaciones como la aplicación Tú Decides para poder comunicarnos con los adolescentes. Lo mismo pasó con la red de jóvenes que se desarticularon de la misma manera. Hemos convocado a jóvenes antiguos que ya tenían la formación porque era imposible trabajar con nuevos. Hemos otorgado megas haciendo convenios con las empresas telefónicas. Hemos instalado rinconets, espacios juveniles en las clínicas de CIES con la tecnología necesaria para que puedan acceder a todas estas actividades. Y bueno, también otra de las actividades que hemos implementado, mejor dicho, las estrategias, fue el trabajo en salud mental, el trabajo en el tema de afectividad, emociones a través de la estrategia de biodanza, ¿no? Herramientas de biodanza que nos permitieron trabajar a nivel integral estos procesos. Creo que de los aprendizajes más importantes que hemos tenido durante esta etapa es pues, que los miedos y la resistencia a lo que eran la tecnología se superaron a través de las capacitaciones. Nos hemos dado cuenta que somos capaces de ser resilientes ante una pandemia. Creo que lo hemos superado, hemos desarrollado competencias a nivel tecnológico, a nivel virtual, hemos logrado combinar recursos tecnológicos para que las clases virtuales sean de la misma manera didácticas que aquellas presenciales que habíamos nosotros siempre ofertado. Creo que al principio creíamos que el manejo integral de la educación integral en sexualidad de manera virtual no era posible, pero sí nos hemos dado cuenta que sí es posible el trabajo de conocimientos, el trabajo de actitudes y de emociones. Y a partir de la capacitación, la posibilidad de poder generar nuestros propios recursos tecnológicos ha sido muy importante, de manera que no nos asustemos de que necesitamos grandes profesionales y expertos para la elaboración de estas herramientas, más bien necesitamos de la creatividad y de la voluntad de las personas para poder generar. Muchas gracias.
Thank you so much, Paola, and thank you for the examples you showed us. Our next speaker is going to speak to the importance of sex positivity and pleasure in the context of in-school and out-of-school CSE. Our next speaker is Philpott, who is a public health professional and pleasure practitioner. She founded the Pleasure Project in 2004 in frustration of endless AIDS meetings where no one talked about people's motivation for having sex or even pretended sexually transmitted infections were airborne. She is on the Sexual Pleasure Task Force of the World Association of Sexual Health, who ratified this declaration of sexual pleasure in 2021. The Pleasure Project is an international education and advocacy organization developing the evidence base for sex-positive and pleasure-based approach to sexual health and rights, which includes over 20 peer-reviewed research articles. They promote sexual health and agency through an emphasis on good sex and by focusing on one of the primary reasons people have sex, the pursuit of pleasure, and by acknowledging diverse desires and means of satisfaction. To you, Anne.
Thank you very much. I'm Annie from the Pleasure Project. Thank you all for the invite to this important and wonderful session. I'll try to be as quick as possible, so I might skip some of the slides given time. But the Pleasure Project builds evidence for and advocates for pleasure-inclusive sexual health, shining a light on an area of sexual health and sexuality that has been stigmatized and often avoided in SRHR. So great that it's been mentioned today already by so many of the speakers. We've been doing this for the past 15 years, and today I'm going to talk about why pleasure is important and a recent evidence review we just launched with the World Health Organization, and also some examples of how pleasure-based sexual health works in practice. On the next slide, I've included the WHO working definition of sexual health, and you'll see in that it states sexual health includes the possibility of having pleasurable and safe sexual experiences, not merely absence of disease. And yet we rarely see sexual health interventions that acknowledge that this is a key reason people have sex globally. And more recently in 2020, the Guttmacher-Lancet Commission stated that a positive approach to sexuality and reproduction should recognize the part played by pleasurable sexual relationships, trust and communication in promoting self-esteem and overall well-being, and the rights of individuals to have safe and pleasurable sexual experiences. So pleasure in sexual health is starting to be recognized as important for effective interventions. And of course, as some of the other speakers have said, the COVID pandemic has meant that we've needed to deliver sexuality education in new ways, and we've seen some examples of that. And many governments have been very innovative in the way that they've redefined safe intimacy during the lockdowns that most of us have experienced. So on the next slide, this is a definition of the Pleasure Project definition of pleasure-based sexual health we published 3 years ago. And you can find this on our website. But in short, this approach states that sex can have beneficial effects and can enhance life and relationships, but can, of course, also have negative consequences. And that the goals and objectives of sexual health and education programs should be focused on pleasure as a means of sexual agency and empowerment. So this definition moves us away from traditional sexual health approaches that have focused only on the prevention of negative consequences such as death, danger, and disease, and ensures we celebrate what people want and how safe sex can improve well-being, bond us to others, and how knowing and asking for what we want is an indicator of empowerment. On the next slide, I've highlighted why is pleasure important. So 2 years ago, the World Association of Sexual Health launched a sexual pleasure declaration. And WAS, the World Association of Sexual Health, was the first organization in 1997 to launch a sexual rights declaration that is now central to all of our practice of sexual and reproductive health. And last year, they ratified the Sexual Pleasure Declaration as a call to action and stated that efforts to improve sexual health have omitted these key components for too long, focusing on other components, as it says on the slide. And it's a call to action for governments, NGOs, and those delivering services to engage with the whole person and the reasons they have sex. So on the right of the slide, you'll see that Sexual Pleasure Declaration, but also a technical guide that was published to accompany that, and the references at the bottom of the slide. And that technical guide summarizes all the reasons of why pleasure is central to sexual and reproductive health. And this includes, it's a long document, but I'm just going to highlight a couple of things. It includes research that has found done in many cultures that pleasure is a fundamental reason people have sex, and that safe sex can improve your health. So solo and partnered sex is associated with improved health, reduced heart disease, increased immunity, increased pain management in some cases, and reduction in stress. So we also know that pleasure-inclusive sexual health interventions may be particularly effective with vulnerable populations who have experienced sexual trauma. And also, pleasure empowerment in sexual health can challenge stereotypes that reinforce damaging norms. For example, that masculinity is enhanced by sexual pleasure and femininity is diminished by it. And of course, it can also protect people's sexual rights by being more comprehensive. And that document also includes evidence that pleasure and sex positivity has been a part of faith, belief, and historical and pre-colonial narratives. The next slide is a summary of all the reviews of evidence to date, answering the question, do pleasure-inclusive interventions improve sexual health? And just to explain, pleasure-inclusive can mean skills training in using condoms, comprehensive discussions of why people have sex and love and relationships, or honest conversations about sexuality, rather than being scared or shamed about the consequences of sex. I need to go a bit slower. All three reviews have found improvements in sexual health, increasing condom use, and sexual efficacy and confidence. I'll just talk in more detail about the WHO review on the next slide. We conducted a systematic review, which is a gold standard way of reviewing the evidence, with WHO, which was published a month ago. This was the question we set ourselves on the slide. It was an extensive review of all the SRHR literature over the past 15 years, which is over 17,000 studies, to examine if pleasure-inclusive interventions had a positive or negative impact on SRHR outcomes. We found 33 studies that included pleasure out of that huge amount, and they were published on February the 14th in PLUS ONE journal, which is an open access journal, so you can access that. Very importantly, so if you move to the next slide, you'll see the results. Very importantly, we found significant and positive impacts for condom use and sexual and reproductive health outcomes, and concluded that future work, SRHR, should incorporate pleasure to make best use of the significant resources put into this work and to be as effective as possible, and that work to date has avoided pleasure in this sector. On the next slide, I'll skip over this, but we did a meta-analysis of 8 studies, that shows that if you pull the results, there was again a significant impact on condom use by including pleasure as compared to usual sexual health and sex education. So this is really critical because this effect size is rarely seen in behavioral interventions. And also because, as we know, there is 1 million STIs transmitted every day in the world. So it's very urgent that we use all effective interventions. The next slide shows what we've done to support this in a practical way. The Pleasure Project launched these pleasure principles 2 weeks ago. These are 7 principles to inspire and guide organizations and people to be able to apply this new evidence and this sexual pleasure declaration. They're not a checklist, but an inspiring guide with tips and best practice. Oh, I've only got 2 minutes. Okay, so you can find these principles on our website, and they're very practical and have lots of examples and best practice. I'll skip the next slide. And that's just a range of examples. And I'll skip this also one, and I'll go on to an example from Nigeria, which is the next slide. So these are some examples of organizations that have included pleasure and their impact. And this is an example in Nigeria of working with HIV positive women and giving them 2 skills training sessions in assertiveness skills. This saw, and it's pleasure inclusive, this saw increased motivation to use condoms and increased self-confidence. There's other great examples in Nigeria with faith-based groups that have also promoted pleasure within marriage as a strategy to enhance monogamy, longevity. And this has been replicated in South Africa, Mozambique, and in India by faith-based groups. Just to speed, if I skip to the next slide, this is a campaign that's been launched by IPPF Africa region called the Treasure Your Pleasure campaign to encourage young people to use their services by promoting the importance of positive relationships, consent and pleasure. The next slide shows work that Amplify Change, a large SRHR grants organization, have been doing. They've dispersed to over 900 CSOs to date and are committed to integrating pleasure through their grants. And they've also endorsed the pleasure principles. These are photos of the first 8 pilots for their expanded pleasure approach. And they're in DRC, Uganda, Tanzania, India, and Lesotho, and includes midwife training, transgender rights, and comprehensive sex education. And then this final slide, the next one, is just to highlight that we conducted research with Rutgers, who's a co-sponsor for this event, to find examples of pleasure-positive sex education in Ghana and Kenya. And this research was published in 2019 and is available on our website and highlights how practitioners have been comprehensive in their sex education. And I'm just wrapping up. So just to say that the title of the journal comes from a quote that a teacher in Ghana said, who detailed how his Islamic faith gave him the values to be pleasure positive. And he needed to tell young people the truth that sex can feel good. He said that if he told them that sugar was bad for them and they put their fingers in the sugar pot and tasted it, they would know that it tastes good and not believe the other things he said, which I think summarizes really well what's important about pleasure-based sexual health. So just on the last slide, this is my final closing slide to say thank you. Please do look at our website to see the research tools and full information about the pleasure principles. And please do think about endorsing them like IPPF and Amplify Change and many others have done. Thank you.
Thank you so much. And it's a great point to end up on with the example of sugar. It's a very good example. We're running out of time, so if we can have closing comments from our speakers, that I thank so much for having with us today. And I thank all of you, of course, for attending. Dr. T, if you would like to have, if you have any comments.
Yes, just in a few seconds, just to say that Comprehensive Sexuality Education is a vehicle to respecting and promoting human rights, and it is important for gender equality as well as the right of everyone to the highest attainable standard of physical and mental health. And states must respect and protect key principles of human rights of non-discrimination, equality, privacy, integrity, as well as autonomy. And we must assist, especially adolescents, in accessing CSE, both online and offline. Thank you very much.
Thank you so much. Julius, do you have any final comments?
No, I'm really happy. I'm learning. The final comment that I wanted to add here is that the pleasure concept need really to be handled with care, especially with the groups that are more anti-CSE. These are issues that we really need to be careful as technical people in order to handle the program very well. And the most tactical way is to integrate these concepts very well in the education system. You integrate them in the curriculum, you will not have any problem. And ministries like Ministry of Education and Health, these ones are more critical. There is no one who can stand up and say Ministry of Health should not provide sexual reproductive health services. No way at all. So therefore, it must be regarded or understood to be a multi-sector approach, which is providing a holistic wellness for the children. But the most important thing to me is definition of the words. Like in my country, if I have to come in to talk about sexual pleasure or the pleasure principle, so kind of, we need really to understand it very well, so that people don't mix it with the promiscuity, to say we want children to experience. Once you introduce them to the word pleasure, they will definitely jump into the sexual pleasure that learners have got the right to enjoy sexual pleasure. Of course, it is their right, but then we need to give this information age appropriately, so that they don't, parents now and the faith-based organizations, they don't think that we are promoting pleasure, sexual pleasure among children. Thanks.
Maria, do you have any final comments?
There's a question about out-of-school CSC, and what I would say is, every country, as Julia said about multi-sectoral collaboration, ministries of youth, ministries of health, the CSO community, youth organizations are all leading on out-of-school CSC, and more countries are having formal out-of-school frameworks and strategies. So, we do have some examples on our website that can be adapted for out-of-school CSC, because really it's a very important space to ensure no one is left behind. And I think that the one way we handle pleasure within out-of-school CSC, aside from showing the full external vulva, for example, is having young people themselves define what pleasure is to them, and safer sex strategies that are non-penetrative, what we call out-of-course. We have a whole lesson plan on that. So there are ways to do it where we're not imposing, but young people are being innovative in how they're navigating their sexual health. And really, my last comment would be that young people are central to all of these discussions. And that's where we have to keep it real and stay the course in supporting young people to maximize their sexual and reproductive health and rights in its broadest sense. Thank you.
Thank you so much, Maria. Paola, if you have any final comments.
Sí, gracias. Creo que la virtualidad llegó para quedarse y los procesos de educación integral sí son posibles a través de la virtualidad. Hay una amplia gama de herramientas virtuales, aplicaciones que nos permiten trabajar metodologías integrales para estos procesos. No tengamos miedo, no nos resistamos, más bien nos capacitemos y conozcamos todo este mundo de virtual que nos ofrece herramientas para trabajar de manera integral en cada uno de los procesos de educación integral en sexualidad. Gracias.
Thank you so much, Paola. And if you have any final comments.
Yeah, thank you. Just to say, do check out the pleasure principles. I think they will respond to many of the points that have been raised. I mean, the 1B universal acknowledges that we all have the capacity to feel pleasure if we want to, but also that we need to contextualize that within different contexts. I've shown a few examples and there's many more in the pleasure principles. And also that, you know, love yourself is one pleasure principle that I really like. It's about making sure that people appreciate and know what they want and can aim for that. But we, as I said, we just have this new evidence with the World Health Organization that pleasure inclusive approaches have a significant positive impact on condom use and sexual health. We can't ignore that when we are responsible for implementing sexual and reproductive health. And so let's be honest, let's acknowledge the reasons people have sex and what they want to get from their sexuality and sex lives around the world, and also honor their rights to be able to live a fulfilling, safe sex life. Thank you.
Thank you, Annie. Thank you. Thanks to all our panelists, all our co-sponsors, and all those who attended our panel today. That was very informing and was very diverse perspectives from different localities. Thank you so much. We hope that this gave a bit of context and shed lights on new perspectives. Thank you so much for being with us today. Bye-bye.